Hi, my name is Shannon Wise, and today I'm here to talk with you about panic disorder. We're going to start off by defining what is panic disorder, what is a panic attack, and what is agoraphobia. Next, we will talk a bit about treatment. And lastly, I will have 4 tips for you to help you manage panic. Everyone experiences anxiety at some point in their lives. It is a part of being human and being alive. Anxiety can protect us, it can help us be productive, it can also keep us stuck when we start paying attention to this false alarm that our body sometimes gives us. So let's get into what is panic disorder. Panic consists of sudden, recurrent, and unexpected panic attacks. Concern about having additional panic attacks, so that becomes panic about panic. Worrying about the consequences of having a panic attack, such as having a heart attack, fainting, or going crazy, and or a change in your behavior due to a panic attack. So for example, not returning to the place where you had a panic attack, or if you had a panic attack while driving, maybe just stopping driving altogether. So this diagnosis of panic disorder, it's categorized with or without something called agoraphobia. And so let's talk about what is agoraphobia. I often think that there is a misconception of what agoraphobia actually is. I think that people have often thought that it means not leaving your home, but it's actually due to this fear of not being in places where you feel like escape is difficult. And so that feeling of being trapped is part of what agoraphobia is. And so an example might be standing in line, traveling on a bus or a train, being in a crowd, waiting at a red light while driving. So those situations are often avoided. That's probably number one. They're dealt with with significant distress. They're dealt with using safety behaviors and having reassurance, whether it's reassurance you give yourself or someone else gives you, and also having a companion accompany you at times to do these tasks that are hard for you. And so that companion can provide reassurance to you. So you might be wondering or thinking, well, I don't even know if I've actually had a panic attack. So what is a panic attack? This is an intense period of fear and discomfort. The criteria for a panic attack are 4 or more of the following symptoms. So I'm going to list those off for you. So we have heart palpitations, sweating, shaking, shortness of breath, feeling of choking, chest pain, nausea, feeling dizzy or faint, derealization, which is feelings of unreality, depersonalization, which is the feeling of being detached from oneself, fear of losing control or going insane, numbness, tingling, chills, hot flashes. So this disorder emphasizes fear of bodily sensations and their meanings. So there's often a cycle that occurs with panic disorder and other anxiety disorders. So with panic, we might experience something like a racing heart, and then to have thoughts about having a heart attack, which then produces more raciness of the heart. Because think about it, if you're thinking about having a heart attack, you're probably going to have an increased heart rate. And then instead of staying in that place of just like letting this dissipate on its own, someone might seek medical treatment, which then leads you back into the cycle of more negative thoughts. And then also you're reinforcing this belief that, well, every time I have these sensations or symptoms, I probably do need to seek medical treatment. So now that we've established some basic information about what is panic attacks, let's get into how panic is treated. So evidence-based treatment for this disorder is cognitive behavioral therapy. So usually in the beginning of treatment, we might learn something called diaphragmatic breathing. And this just simply means that we're going to breathe from our diaphragm or our belly and not from our chest. So I'll often ask people to make sure that they're breathing from their belly and not their chest by placing a hand on their chest and a hand on their belly. And if your belly is rising when you take in your breath and not your chest, then you kind of know you're doing it in the right way. So we practice learning to slow down our breathing. That's one of the things, because when we are panicking and we're anxious, we often tend to overbreathe. And a lot of times we're trying to breathe really deeply and take in more air. And what we actually want to do is we want to slow it down. So there's two methods that I often teach clients, and one is called box breathing. And so this is a 4-4-4-4. And so you want to imagine that you're going in like the shape of a box. Okay. So you're going to breathe into the count of 4, hold to the count of 4, out to the count of 4, and hold to the count of 4. And then you would repeat that again. Okay. And so it just kind of looks like this. And that gets you to slow down. And actually you're focusing a little bit on that, on your breathing. So that is one exercise. And I usually tell people you should just do this as a practice. So maybe like 10 minutes a day, or start your day off with some box breathing. Another one is 5-7-8 breathing. So this is where you breathe in to the count of 5, hold to the count of 7, and out to the count of 8. And so when you're breathing out to the count of 8, so you're going to be really pushing it all the way out. You're going to feel like you have no air left in there, but that's like really important part of it. So that gets you to really slow down too. So that's another one you could practice and just start doing. And so think of it more like a meditation practice. And so we don't want to, I just want to state this, that we don't want to do this in response to having anxiety or having panic. We really truly want to use breathing as a practice and something that can just be part of our life, just like if we would do yoga or meditation or something like that. So it's really just part of like kind of a healthy lifestyle. So the next thing we would do is we would identify and eliminate safety behaviors. So an example of some safety behaviors might be avoiding going to the movies. Like if you've had a panic attack at the movies and you feel trapped when you're in there, you might avoid going there. So another thing might be carrying a water bottle with you because you think like, if I have that choking feeling, then I can have my water with me. Something else is like having someone stay on the phone with you while you're in the car, just to kind of help you get through that driving process, or having someone follow you somewhere if you're fearful while you're driving. So these are all things that we would like identify, and then we would work to gradually decrease any safety behaviors. Okay. The next thing we would want to look at is negative thoughts and predictions about panic. And so we might do this by looking at dysfunctions in thinking. So sometimes I'll provide clients with a list of cognitive distortions and getting people to identify and label like what they're doing in the way that they're thinking. Another thing might be looking at the probability or the likelihood that something would come true. And we might also look at the evidence for or against the thought. So those are just some cognitive ways to really, really look at what we're thinking due to panic. Next, we would plan for exposure to face difficult situations. So all through treatments, most of the time, I would have individuals identifying and recording triggers and when panic occurs for at least a period of time. We want to collect some data. And so that is one of the things that we're going to build like I guess we could call it a hierarchy or a list to complete exposures. And so we'd start addressing exposure from that. And in this part of treatment, we'd also want to create exposures to bodily sensations. So if there's something that triggers a certain bodily sensation, we'd certainly use that, but we might also intentionally try to create these bodily sensations that feel like panic. So we might have you breathe through a straw, or I've had some folks wear masks and do some exercise, like some mild exercise, just to feel like they're not catching their breath in the way that they normally would. And then it sort of brings on this feeling of panic. So those are called interoceptive exposures. And then we've gotten to the point here in this presentation where we're just going to talk about 4 tips for managing panic. And so number 1 is don't fight the panic, okay, or try to stop it. Just really, really allow it to happen. Like the one thing that I would say to anyone with an anxiety disorder is really, really to work on acceptance and just kind of saying, okay, here you are again. And like, let's really just welcome it in and not react to it. So the other thing we want to do is just, again, notice our breathing. We might just try to slow down our breathing. We're not going to be practicing breathing exercises at that time, but just like checking in about that. The third thing is that we want to like use our senses. So we can use all 5 of our senses to notice other things around us. And focus on what we're actually doing. So right now I'm at home here and there's someone doing lawn work outside. I can hear, like, I think it's a leaf blower. So if I was trying to be present and notice what's going on around me, I might notice that sound of the leaf blower and like really, really focus on that. But instead I'm here doing this talk. And so that's what I'm trying to focus on at the moment. But we could, again, we could focus, like if there's birds chirping outside, we could focus on the sound of those. Or if you're having a conversation with someone, we could focus on the sound of someone's voice. And the 4th thing is to just know the facts about panic. You might get yourself a little index card and make some notes, even if it's stuff from today's presentation, you could just take a couple notes, some things that really matter to you, or at least to you in regard to your thoughts about anxiety or panic, and jot those down. And we kind of want to put those in our bank of knowledge. We don't want to repeatedly go to them or always need to have them. But I think if we at least have some information there, that can be helpful to us. On this card, you could also write a couple encouraging statements to yourself. So we don't want to be like super reassuring, like, you're going to be fine or it's okay. We don't really want to say things like that, but we can also say like, you know what, you've got this, like you can do this. You've been through stuff like this before. You could make some statements like that on there. And so just remember that it's our response to panic, anxiety, and our thoughts that matter. The more we avoid and use safety behaviors, the stronger our thoughts and fears become. This is just a quick overview for you. If you'd like more information on panic disorder or cognitive behavioral therapy, please reach out to the ADAA online or look for a therapist trained in cognitive behavioral therapy and exposure and response prevention. Thank you for joining us today.